Hello, my name is Jerald Payne, and I am a therapist in private practice, practicing here in the Kansas City metropolitan area. I've been in private practice here for the past 24 years and am licensed to practice in both the states of Kansas and Missouri. A couple things I wanted to talk about. One is, people always talk about the stigma around mental health and, that African Americans do not attend therapy. And something that I have been saying for probably the past decade is that I don't believe that African Americans do not attend therapy. I think we still have the stereotype of being the last group of people to show up for therapy. But Black folks have done a great job of pushing through the stigma and seeking mental health treatment when they are needing to do so. And so to kind of support this, because I decided, well, let me take a look at my own caseload and see what the exact numbers are. And so I looked at my numbers over the past week, and 75% of the clients I saw were African American. 32% were African American males age 18 to, I think the oldest was 70. And the reason why I'm pointing that out is because out of African Americans, it is believed that Black males are the last to show up. And Black males were the last to show up for therapy. African American females have always done well. African American teenagers actually have always done well. I have, teenagers who text and schedule their own therapy sessions. I have seen court-ordered teenagers over the years who voluntarily continue therapy after the court has said that they have to do so, whether it's kids in foster care or kids on juvenile probation. They oftentimes choose to continue therapy beyond the court order. I've even had kids who were court ordered to do like anger management groups, and then they would voluntarily, do a whole nother section of group. And so the teenagers have done well over the course of my career, over the course of 24 years. Even when I was at the mental health center with a caseload of 83 clients, I saw tons of teenagers, tons of African American females, a nice amount of Black males, but that has increased considerably. And something that I've noticed is over the course of the pandemic, I have been getting older African American males coming in for therapy for the most common reasons that people come to therapy, which is anxiety and depression, which kind of takes me into the next thing that I wanted to address about mental health. The idea that if you go to therapy, then you are crazy or, you're mentally ill. And that couldn't be further from the truth. In actuality, every single person over the course of their lifetime is going to meet the criteria for not just one, but several mental health diagnoses. And it is for those diagnoses that people come to therapy to work through those issues faster than what they would on their own, definitely faster than getting help from, their cousin and their best friend. Here's an example of some of the diagnoses that every person meets the criteria for. Bereavement. If you experience the loss of a loved one, that is the diagnosis of bereavement. And over the course of bereavement, people oftentimes experience the symptoms of depression, such as tearfulness, crying, decreased appetite, sleep disturbance, having trouble falling asleep at night, waking up in the middle of the night, having trouble going back to sleep, waking up really early in the morning, hypersomnia, wanting to stay in the bed and sleep, disturbing dreams, all of those are symptoms of depression, poor concentration, decreased motivation. All of those are the symptoms of depression that occur when we have experienced a loved one. That doesn't make us mentally ill, it makes us normal. And the diagnosis for that is adjustment disorder with depressed mood. The vast majority of my clients who come in for therapy are coming in for one of the adjustment disorders. Adjustment disorder with depressed mood is when a person has all the symptoms of regular depression, which is major depressive disorder, but if it is triggered by a life event, a life circumstance, the diagnosis is adjustment disorder with depressed mood. And both positive and negative things that occur in our life can kick us into that. For example, if you are experiencing a lot of work-related stress, your job is very stressful, or there's problems on the job or problems with your employer, that can kick you into adjustment disorder with anxiety. If you are having some problems in your relationships with other people and you are reacting in a way that is a little out of character, and you are experiencing a lot of increased anger, that is adjustment disorder with mixed disturbance of emotions and conduct, because you're not yourself. And so the thing about the adjustment disorders, because there's several, there's adjustment disorder, with just anxiety, adjustment disorder with just depressed mood, with anxiety and depressed mood, there's a list of them. The thing about the adjustment disorders is when life happens, things happen unexpectedly. It can it's like throwing a curveball. It can throw us off of our game for a little bit. That is the adjustment piece. And so the process of readjusting to your new normal, or adjusting to a situation that you are trying to rectify and do problem solving, that's adjustment disorder with depressed mood. Every normal person will meet the criteria for an adjustment disorder. The only people who might not are sociopaths, but then they meet the criteria for sociopathy, which is which is antisocial personality disorder. So even the sociopaths don't escape meeting the criteria for a diagnosis. Here's some other diagnoses that every single normal person has experienced or could experience over the course of a lifetime. Okay. I already talked about work-related stress can kick you into adjustment disorder with anxiety. Parenting problems, the diagnosis, parent-child relational problem. Marital problems or problems in your relationship, romantic relationship. Well, that's the diagnosis of relationship distress with spouse or intimate partner. There are even diagnoses, in looking at the DSM, which is the diagnostic manual, there are even diagnoses of extreme poverty, low income, phase of life problem. Now, this is a very common diagnosis. Your high school graduate who is heading off to college, entering a new phase of life, can struggle to adjust to that. That's phase of life problem. That's a diagnosis. The college graduate who has gotten a job in another state across the country, away from all of their family, adjusting to entering that phase of life from college student to adult professional. Struggling to adjust to the transition from single person to married person to married couple with children. People who go into retirement oftentimes experience phase of life problems and meet the criteria for that diagnosis because they've gone from working 40 hours a week to being retired, which oftentimes kicks people into adjustment disorder with depressed mood. I have seen many retirees who drop down into depression because they don't feel that their life has the purpose that it had when they were working. That's something I'm going to have to be looking out for myself, although I doubt that I'll ever stop doing therapy. Okay, so I just wanted to address that one, Black folks, you're doing a good job of showing up for therapy. You have done a great job of realizing that it doesn't mean that you're crazy because you're going to therapy. So I just want everyone to know, if you are struggling with something, especially the two most common things that our people and all people are struggling with right now, which is anxiety and depression, do not hesitate to reach out and get the help that you need in order to develop some advanced level coping skills and mechanisms for dealing with that. Okay, we're all born with a level of coping skills to get through life, but when anxiety and depression hit, it can hit very heavy, and a therapist can assist with the cognitive, which is our thoughts, the cognitive and the behavioral coping skills and interventions for managing and overcoming the symptoms of anxiety and depression.